Workers over 50 face fundamentally different physiological responses to overtime and shift work compared to younger colleagues, creating safety implications that one-size-fits-all scheduling ignores. Age-related changes in sleep architecture, tissue healing, and metabolic recovery mean older workers need different protections, yet mandatory overtime policies treat all workers identically. Understanding these differences could prevent injuries while leveraging older workers' experiential advantages. Sleep efficiency deteriorates progressively with age. Older adults spend less time in deep restorative sleep stages, wake more frequently, and need longer to fall asleep even under ideal conditions. Shift work and overtime exacerbate these problems catastrophically. A 60-year-old working rotating shifts may never achieve adequate sleep quality, accumulating sleep debt that impairs cognitive function and increases accident risk far beyond what a 25-year-old experiences on identical schedules. The night shift differential that compensates younger workers inadequately addresses the biological burden on older workers whose circadian systems recover more slowly. Tissue healing and injury recovery follow similar age gradients. Repetitive strain injuries accumulate over careers. The 50-year-old machinist has decades of microtrauma to hand and wrist tissues. Additional overtime prevents adequate recovery time, pushing cumulative damage past the threshold where tissues can repair themselves. The result: chronic conditions like carpal tunnel syndrome, tendinitis, and degenerative joint disease that disable workers precisely when they should be earning peak wages. Younger workers performing identical tasks may tolerate the repetition better simply because cumulative exposure is shorter. Paradoxically, older workers often demonstrate superior safety records in terms of accident frequency. Decades of experience create pattern recognition skills. They notice equipment sounds indicating malfunction, recognize hazardous situations before they develop, and have internalized safety procedures as automatic habits. This experience partially compensates for age-related physical decline. However, when older workers do have accidents, injuries tend to be more severe and recovery longer. A fall from height that gives a 30-year-old a concussion might kill a 60-year-old due to reduced bone density and healing capacity. The economic injustice compounds with age. Older workers often need overtime income most desperately, caring for grandchildren or elderly parents, facing medical expenses from age-related conditions, and trying to compensate for inadequate retirement savings. Yet they tolerate overtime worst physiologically. This creates impossible choices: accept health-damaging overtime to meet financial obligations, or preserve health while facing economic crisis. Younger workers may work overtime to save for houses or vacations. Older workers work overtime to pay for insulin and avoid eviction. Age discrimination in overtime assignment cuts both ways. Some employers prefer younger workers for overtime, assuming greater stamina and fewer health complications, effectively denying older workers income opportunities. Others exploit older workers' financial desperation, assigning excessive overtime knowing they cannot refuse. Both patterns are problematic. The former is age discrimination. The latter is exploitation of vulnerability. Policy implications are complex. Should overtime limits vary by age? Such policies could protect older workers' health, but also enable discrimination, with employers refusing to hire older workers due to limited availability. Should older workers receive higher overtime rates compensating for greater physiological burden? This creates fairness issues and might incentivize dangerous overwork. Should employers be required to offer alternative schedule accommodations for older workers, similar to disability accommodations? This seems reasonable, but adds complexity to staffing. The most equitable approach may be universal overtime limits that protect all workers while being especially beneficial to older workers who need it most. Nobody, regardless of age, should work 70-hour weeks regularly. Strict hour limits prevent exploitation of both youthful stamina and older workers' financial vulnerability. Adequate base wages eliminate age-agnostic overtime dependency. Workplace accommodations can leverage older workers' strengths, while mitigating age-related vulnerabilities. Pairing experienced older workers with younger counterparts for physically demanding tasks combines experiential knowledge with physical capacity. Job rotation that gives older workers more cognitively demanding, less physically punishing assignments as they age maintains productivity while reducing injury risk. Flexible scheduling allowing older workers to choose shifts compatible with their sleep patterns could dramatically improve alertness and safety. The demographic reality is that workforces are aging by 2030. Workers over 55 will comprise a quarter of the American workforce. Employers clinging to overtime models designed for younger workers will face increasing injury rates, workers' compensation costs, and talent shortages as older workers burn out or become disabled. Forward-thinking organizations are already redesigning work to accommodate aging physiology, finding that accommodations benefiting older workers, more recovery time, better ergonomics, schedule flexibility, improve outcomes for all ages. The question isn't whether to adapt to aging workforces, but whether to do so proactively through intelligent policy or reactively through accumulated injuries and litigation. Workers of all ages deserve schedules that don't destroy their bodies, but for older workers, the margin for error is smaller and the consequences more severe.